Hello guys, so now we shall be discussing regarding the area which is present in the anterior part of the nose. This is called as a Little's area or Kiesselbach Plexus. Okay, so we shall discuss about Little's area. Okay, or you can also call it as Kiesselbach area. Kiesselbach area. Actually, there are a few arteries that together they join and form a plexus. That is why you call it as a Kiesselbach plexus. Okay. So basically, main two arteries which are responsible for formation of the plexus here, right? One is called as the internal carotid artery. Another one is called as the external carotid artery. So let me rub out these meatus over here. Now you will understand the thing which I am discussing right now. There are two important arteries as I told you. So one artery is called as your internal carotid artery. Internal carotid artery. Okay. So this artery is called as internal carotid artery. Internal carotid artery. Now this particular internal carotid artery, whatever is there, this will give you a branch. Okay. The branch of internal carotid, one of the branch of internal carotid artery is ophthalmic artery. Okay, so the artery name is ophthalmic artery. Now this ophthalmic artery gives out two branches. Before giving those two branches, you should understand one very important thing, that this part which I am rubbing right now is your ethmoid bone. Okay, so this ethmoid bone is having an opening in the front, it is having an opening in the back. This opening in the front is called as anterior ethmoidal foramen. On the back is called posterior ethmoidal foramen. One is called anterior ethmoidal foramen, another one is called posterior ethmoidal foramen. So why am I telling you this? The reason is that this ophthalmic artery gives two branches. One branch passes through this anterior ethmoidal foramen like this. Okay. Another branch passes through this posterior ethmoidal foramen in this way. Clear? So what are these two branches? One branch is passing through anterior ethmoidal foramen, another one is passing to posterior ethmoidal foramen. So this branch is called as anterior ethmoidal artery and this branch is called as posterior ethmoidal artery. And what are these foramens over here called? This foramen is called as anterior ethmoidal foramen and this foramen over here is called as your posterior ethmoidal foramen. So we have got two foramens, anterior ethmoidal foramen and posterior ethmoidal foramen, right? Next important thing over here is that here you have got another artery that is called as your external carotid artery. This artery over here is called as your external carotid artery. Now this external carotid artery is giving two branches. See, this is one branch, this is another branch. What is the name of this branch? This is called as a facial artery. This is called facial artery and next one is called as a maxillary artery. Maxillary artery. So one is called as a facial artery and the next one over here is called as your maxillary artery. Now this facial artery gives one more branch and this is called as superior labial artery. This is called as superior labial artery. So this artery is called superior labial artery. Okay. And this superior labial artery is giving the last branch that is called as your septal branch. Why are you calling it as septal branch? Because you know this is your nasal septum and this is the branch that goes all the way up and supplies to your nasal septum. So this is the septal branch which is actually supplying to your nasal septum. After this, you know the maxillary artery over here, right? So this maxillary artery is giving one very important branch. See, this is one very important branch over here. This branch is called as greater palatine artery. What is the name? It is greater palatine artery. Not only greater palatine artery, it also gives one more branch and that is called as branches of sphenopalatine artery. branches of sphenopalatine artery. So one is called as a greater palatine, another one is called as a branches of sphenopalatine. So this greater palatine artery goes all the way and supplies here, right? And this sphenopalatine artery is also going all the way and supplying here. So all of these branches together they join and form a plexus, you see. All of them together they join and form a plexus here. So this plexus is nothing but called as your Little's area or Kiesselbach area, right? So why this area, why this plexus is very important is that basically the nosebleeds, right? Most of the nosebleeds they happen through this area. Why? Because whenever there is a nosebleed, there is a heavy bleeding, right? So this heavy bleeding occurs when this area is damaged. So whenever you hit on the nose, the most common nosebleed which is happening because of the rupture of these arteries, these plexus, right? There are two different types of nosebleed. Any kind of nosebleed, you call it as epistaxis. Any kind of nosebleed, you call it as epistaxis. So there are two different types of epistaxis. One is called as physiological, another one is called as pathological. Okay, what is physiological? For example, whenever there is excess heat that is produced in your body, right? So in that case, to remove this heat will damage your organs. So to remove the heat out of your body, the bleeding occurs from the front part of your nose, right? I think this you might have observed it a lot of times. Whenever you have a habit of eating spicy foods or the fast foods all the time, a lot of heat is generated and you see the nose bleeds occasionally coming out, right? So that is called physiological epistaxis. Pathological is someone beats you and if there is a rupture of this area leading to the bleeding, that is called as pathological. When it comes to anatomy, right, what you need to know is that what are the arteries that are responsible here. So one artery which you should know is anterior ethmoidal, posterior ethmoidal. Next we have got septal branch, greater palatine artery and branches of sphenopalatine. So these two are the branches of maxillary. Septal branch is a direct branch of superior labial, which is internal branch of facial, and external carotid. So external and internal carotid branches together they form this Little's area or Kiesselbach area, right? So this is all you need to know about this topic. Thank you so much for watching my video. Goodbye.